This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. We begin today's show in Florida, where authorities have obtained a search warrant to investigate the deaths of 8 elderly residents at a nursing home in Hollywood, Florida, in the aftermath of Hurricane Irma. The victims range in age from 71 to 99 years old. They died in the Rehabilitation Center at Hollywood Hills after a transformer was knocked out following the hurricane, causing the nursing home's air conditioning unit to shut down. Beginning just this past Tuesday night, temperatures began to soar inside the center. Authorities say administrators of the nursing home were aware the air conditioning unit had failed and that they installed fans and portable air coolers inside the facility. But the remedies did little to protect the residents from the sweltering heat. At 3 a.m. Wednesday morning, one nursing home resident was rushed to the emergency room across the street at Memorial Regional Hospital, a Level 1 trauma center. An hour later, another elderly patient arrived. By 5 a.m., when the hospital received a third rescue call, some hospital workers went down the street to check on the nursing home. They found a situation so critical, the hospital sent in more than 50 medical workers under a mass casualty protocol. At least 3 people were found dead. 158 more were evacuated, many with severe dehydration and other heat-related symptoms. This is Hollywood Police Chief Thomas Sanchez announcing a criminal investigation.
This is very tragic. It's very sad. Many of us have loved ones in assisted living facilities, and we expect that care to be there for those people. We immediately started a criminal investigation into this matter and made sure that everyone was evacuated, and we took control of the entire building immediately thereafter.
New details about the nursing home emerged throughout the day Thursday, including the fact a number of safety violations had already been reported at the facility, including 2 violations about its backup power capabilities. This was before the storm. The main owner of the nursing home, Dr. Jack Michel, also has a history of running afoul of healthcare regulators. In 2006, the Justice Department fined another hospital that Michel runs, the Larkin Community Hospital, $15.4 million over civil fraud allegations. Florida Governor Rick Scott has now directed the Agency for Health Care Administration to terminate the nursing home as a Medicaid provider. For more, we go directly to Florida to speak with 2 guests. In Fort Lauderdale, we're joined by Stephen Hobbs, a reporter for the Sun-Sentinel, who's been covering this story. And in Miami, Dale Ewert. He is a vice president of 1199 SEIU, the United Healthcare Workers Union East. We welcome you both to Democracy Now! Stephen Hobbs, you've been reporting on this story. I briefly outlined what happened, but why don't you fill us in from the beginning?
Well, thank you for having me, Amy. What happened, it sounds like, according to the reporting that we've done so far, is after the storm hit in the afternoon on Sunday, the transformer, there's 2 transformers that feed power into the nursing home facility. The transformer that provides power for the air conditioning unit went out. The other transformer that provides power to the rest of the building kind of flickered but remained on. So it was about Sunday afternoon that the air conditioning went out, and as it went on, administrators at the nursing home say that they tried to contact utility officials at Florida Power and Light and other officials in the state and in the county to let them know that they needed power. And as the days went on, they tried, as you mentioned, to use coolers and fans to try to cool down the residents there. They say that efforts were made on Monday and Tuesday, and that they were told by utility officials that people would come out, and that never happened. But as you mentioned as well, temperatures started to rise, and when people were sent to the hospital on Wednesday morning, hospital staff realized that they had a real situation. And that's something that we're still trying to figure out as to why the administrators were saying, they never sounded the alarm saying that we have an incredibly serious event where people could die. And then when hospital staff showed up on Wednesday, they realized that they had a mass casualty event and that they needed to send in people immediately.
And this was after the first patient was brought in dead, then the second patient. This is just across the street, right? The nursing home right across the street from a Trauma 1 center.
Yes, it's right across the street. And what happened, a nursing officer from the hospital said yesterday that, yes, she was alerted. She was working in the command center for the hospital after the hurricane, and she was alerted by emergency room staff that 3 patients had been brought in with very high temperatures. And so she went over, because it was across the street, and investigated herself. And when she walked in, she said it was very warm. She couldn't give an exact temperature, but she saw people in serious distress, people that looked dehydrated, people that looked like they were having respiratory problems. And she said staff inside were frantically trying to bring people into an area where they had coolers and fans to try to cool people down. So she went in with fire rescue officials, and they realized that they had a very serious situation. And that's when the hospital kicked into gear and started sending more people over, started sending wheelchairs and stretchers to get people out of that home.
Now, the nursing home says they contacted Florida Power and Light. Florida Power and Light refused to speed up its response to senior living facilities, they say. They say the county never listed nursing homes as critical facilities in power outages. Is this true?
Yes, and then the county said that they did that because Florida Power and Light guidelines don't have nursing homes as critical infrastructure facilities. So as you can tell, there's a lot of kind of pointing back and forth as to maybe who should have stepped in here. But yes, those are the arguments that the sides are giving as to why something wasn't done earlier.
I wanted to bring Dale Ewart into the conversation. I mean, so often a catastrophe like this, a climate catastrophe in this case, lays bare the weaknesses of a system and also shows us the importance of government and regulations. But how is it possible nursing homes, where the most vulnerable people are not considered critical facilities in power outages?
It really is a good question. This was a tragedy, and it raises questions and concerns not just about what happened in this particular situation, but how all nursing homes in Florida are regulated and whether we're going to require accountability and transparency, and whether nursing home owners like the owner of this particular facility that have a history of abuse should even be allowed to operate healthcare facilities. Certainly things like putting them higher up on the FPL list and requiring facilities to have standby generators that would run air conditioning systems would make a whole lot of sense in a place like Florida. But there are broader questions about what we're willing to allow nursing homes to get away with and what kind of accountability we want to have for the billions of dollars in public money that supports this industry.
You know, you have these 2 states that are so hard hit by this climate catastrophe, 2 hurricanes, Irma and Harvey. 2 states that are headed by climate change deniers, but also, for some reason, part and parcel of that, 2 states headed by those who hail their states as states where regulation will not get in the way. Let's put it that way. I wanted to turn to Texas to talk about an image that went viral during Hurricane Harvey. It was a picture of elderly residents at La Vida Bella Nursing Home in Dickinson, Texas, sitting in waist-deep water. It's this astounding picture. They're in their wheelchairs. I think one woman is crocheting, and the water is up to their chests. 15 residents sit patiently awaiting rescue, which came shortly after the image was retweeted more than 2,000 times. Interestingly, the photo was taken by the owner of the facility, who had reached out for help. She sent it to her daughter in Florida, whose husband put it out on Facebook, calling for help. Some dismissed it. They said this has to be photoshopped. Dale Ewert, can you talk about this case as well?
I'm not familiar with that particular case, but you started off by talking about the governors of both states being fans of deregulation, as is our legislature. The problem is that nursing homes are funded by our tax dollars. 70–80% of the revenue that supports this industry is our money through Medicaid and Medicare, and it is simply not appropriate to have an industry that's on the public dole. I mean, I would say we should question whether it's appropriate to have an industry that takes care of frail elderly people that is run by for-profit corporations. But if we're going to do that, then we have to have appropriate regulation that makes sure that staffing levels are sufficient to provide quality care, and that nursing home operators are accountable for the money they receive and for standards of care. And that's a problem that is not, that's a day-to-day, 365-day-a-year problem, not just in natural disasters like this.
Can you talk more about nonprofit nursing homes, and also what efforts are there now to improve conditions in nursing homes? What political roadblocks do you face? And talk about your perch at the union and why unions are significant here.
In some ways, we're really, in Florida, unfortunately, going in the wrong direction. Back in 2002, Florida passed a series of nursing home reforms that, among other things, created some of the highest staffing standards in the nation for Florida's nursing homes. And in the 10 years that followed, the nursing home industry, using its political connections, has rolled those back significantly. A year from now, there are going to be reforms in the way nursing homes are paid by Medicaid, which will result in a transfer of money from high-quality, high reimbursement nursing homes, who are predominantly, they're not exclusively not-for-profit, precisely to the low-paying, low-performing nursing home facilities. It's a real taking from the good actors and rewarding the bad actors. And there are real serious concerns in the industry about what this is going to mean for staffing levels, which are already in trouble. Having a union is an important voice for healthcare workers. Most of the hands-on care that's done in nursing homes is done by certified nursing assistants, and they tragically subsidize this industry through poverty-level wages and poor health care and retirement benefits. It's a labor of love, but it is a crime that we ask our nursing home residents and our nursing home caregivers to subsidize the activities of for-profit corporations.
I wanted to go back to Stephen Hobbs, the owner of the Rehabilitation Center at Hollywood Hills in Florida. Dr. Jack Michel has a history of healthcare fraud and violations. In 2006, Michel settled claims after he and 5 associates were accused of agreeing to send patients to the Miami hospital he owned for unnecessary treatment, according to the Department of Justice. Michel became president and CEO of Larkin Community Hospital in 1998 and became sole owner in 2006. He settled the case the same year for $15.4 million. The facility was cited for federal code violations on at least 2 occasions for issues related to its generators. And according to the Miami Herald, there's at least 1 pending lawsuit against the Rehabilitation Center alleging negligence brought by a former resident. Stephen Hobbs, this record, its significance, and what is happening now to these nursing home residents?
Well, it's obviously something that people are looking at very strongly now and just wondering, with more scrutiny as to the status of the people in this facility. I think as we look into the record, we realize that there were issues in the past. They had rectified the generator issues, but obviously it's a larger issue in Florida in that nursing homes aren't required to have a backup generator to power them in a situation like this. And officials in Hollywood, as you mentioned, they're trying to use a search warrant. They were either going to execute it last night or or today to try to get more information. There's an ongoing criminal investigation as to what was happening in the facility and what happened, and so that's going to be something that will continue. I was there yesterday, and police had caution tape around the facility. There were police vehicles completely around it, and they were waiting to go in there and gather more evidence as part of their investigation. Finally,
let me put this question to Dale Ewert. Your governor, Rick Scott, is the former chief executive of Columbia HCA, overseer of the largest Medicare fraud of all time. Can you talk about his history?
Yes, when the governor was head of what was then called Columbia HCA, he was, as you said, at the helm when that company was charged with Medicare fraud. This is also, Florida is sort of ground zero for Medicare fraud. There have been recent examples in the nursing home industry of Medicare fraud. But again, for me, it gets back to the question of what kind of transparency are we going to insist on knowing who is owning and controlling and operating these facilities, and what kind of accountability are we going to have to make sure that quality of care is being provided, and that we hold nursing home operators, healthcare providers to the highest standards of care. I think we don't do that effectively enough, and I'm concerned that with respect to funding of nursing homes in Florida, we're actually perhaps heading in the wrong direction.
Very quickly, we just have 30 seconds. For people who are watching this in this country and around the world, what should they be concerned about right now? If they themselves are in a nursing home, if loved ones are in nursing homes, what should they be asking about? What kind of information do they need to demand to ensure that their loved ones or they themselves are being treated well?
Access to information isn't as good as it should be, but I would recommend the Medicare.gov website, Nursing Home Compare. It is a way of finding out ownership information, quality assessments. You're able to compare nursing homes head-to-head if you're trying to choose. It's probably the single best resource right now for people who are concerned either about where a loved one is currently placed or are looking to place a loved one in a nursing home to try to make the best decisions that you can. Nursing Home Compare.
I want to thank you so much both for being with us. So we'll continue to follow the story. Dale Ewert is Vice President of 1199 SEIU, based in Florida, speaking to us from Miami. And thank you to Stephen Hobbs, a reporter at the Sun-Sentinel, speaking to us from Fort Lauderdale. We will link to Stephen's articles at democracynow.org. When we come back, the U.S. Virgin Islands, what's happened? We'll talk about the devastation with a native of one of those islands, St. Thomas. Stay with us.